Good afternoon, sir. Good afternoon, sir.
Yes, hello. Hello, Professor Wang.
Hi. Yes.
Yeah, hello.
Yeah.
Very good
So
afternoon.
everything is well connected.
Yes,
Uh-huh.
this is a connected. Okay.
Mm.
We'll start very shortly. Within 10 minutes, our
Okay.
program will be start.
Okay. So
Yes.
I will prepare a little bit. I'll come back in about 5 to 10 minutes.
Okay, sure, no problem.
Yeah.
Okay,
Okay.
thank you.
Thank you.
Yes.
Okay.
Who is the first speaker of our this program?
Okay.
Yes. We'll start exact 4 p.m. in the Indian time. Yes.
Okay. But this time, most of the people, are they returning home?
Yes, hello.
This time, is the people still around in the university?
Yes, this is the actually all.
Time, right? Yeah.
Yes, now time is the 3:45 in Indian time.
I see.
And everyone is the work from home due to the pandemic situation condition of COVID-19.
All right.
Yes.
Oh yeah, today is Sunday. I forgot.
Today is the Sunday, yes.
Yeah.
That's why. Our almost our participants 5,000 plus
Oh, okay.
all around the various parts of the India, different states and some of the abroad also.
The Bharat technology is at the Calcutta, right?
Yes, Calcutta, yes.
Is in the center of Calcutta or?
The center almost in 30 kilometers from the proper Kolkata.
Okay.
City of Calcutta, 30 kilometers.
Okay. Okay.
Yes. So I think your time is now 2 p.m. or in your time in Malaysia is the timing now?
Now is 6:16.
Okay, 6:16. This is the some.
Yes. Yes.
Okay.
So this one will be 6:30 until 8 o'clock.
Yes, yes, right.
Yeah. Then followed by the other speakers.
Yes, right. Okay, we'll start within 5 to 7 minutes.
Okay.
Okay.
শুনতে পাচ্ছি না, ওরা আগে নিজেদেরটা ঠিক করে দিলে শুনতে পাবো। বিস্মিতা পোস্ট
হ্যালো গুঞ্জন, শুনতে পাচ্ছ?
Yes, sir, you are audible.
Audible. Okay, thank you. When it will start?
Sir, start. It will be start within 5 minutes. Just 4 p.m.
Who is this first? The first speaker.
Professor Wang is the first speaker.
Hello, Biplab sir.
Yes, start the program.
Am I audible, sir?
Yes, yes, you are audible.
Okay. Biplab sir, another 5 minutes are there.
Another 5 or
Shall we wait or
okay, we can start.
shall we start or
Yes, you start.
hello? Biplab sir, speaker sir
Yes.
came or not, sir?
Yes, speaker already came, 2 speakers.
Okay, okay, sir.
They are present, both.
Gaurango sir is ready?
Yes.
Okay, sir. We'll start, sir. We'll move.
Yes, start, move.
Yes, please start.
Okay, sir. Okay. So, hello everyone. Respected eminent speaker of today's webinar, Dr. Tin Wei Wang sir, convener, Dr. Biplab Devnath sir, chairman of today's webinar, Dr. Kuntal Hazra sir, our beloved chairman, Professor Dr. Ravindra Devnath sir, faculty from other colleges, research scholars, my dear students, participants, my faculty colleagues, ladies and gentlemen. A very good afternoon to one and all. It gives me immense pleasure to extend my warm welcome to all of you on behalf of Bharat Technology. I appreciate all your presence at these very difficult times. We are delighted and honored to host our webinar series 2. It gives me immense pleasure to extend my warm welcome to all of you on behalf of Bharat Technology.
This is the echo going on.
I appreciate all your presence at this very difficult time.
Okay, I am starting. Okay. Very good afternoon, all delegates. It is an honor and privilege for me to welcome you on behalf of Bharat Technology to this international webinar, Modern Approach to Combat Against Cancer and Diabetes, which has been organized by Bharat Technology, Department of Pharmacy. Bharat Technology's online webinar series to spread the knowledge on health and pharmaceutical sciences to continue on a roll. Topic focusing on several important areas in the field of health and pharmaceutical sciences. Biotechnology bring together experts from many locations around the world to offer best practice in these different domains. Before starting the webinar series, we thought that the number of registration would not cross 500. But with your love and blessings, we have reached 5,000 registration from different parts of the country and also from abroad. May this viral spread of learning continue to flourish. We will continue organizing such webinar series. Please stay tuned and join our Telegram group for more. All sessions will be online and free of cost, but registration is compulsory. Meeting links will be sent to those registered. So please register soon for our upcoming session. It will be 19 July, Sunday. Being the convener of the webinar, I, Dr. Biplav Devnath, would like to declare that the webinar is now open. I am delighted to welcome all the distinguished participants. I thank the experts for accepting the invitation of Bharat Technology. In particular, I would like to express my gratitude and warm welcome to our eminent speakers, Dr. Tin Wei Wang, Professor, Non-Destructive Biomedical and Pharmaceutical Research Center, I Promise, University Technology Mara, Malaysia, and Dr. Richa Dairamani, Principal, Khyati College of Pharmacy, Ahmedabad, Gujarat. Both have vast knowledge in the field of pharmaceutical technology. I would like to express my hearty welcome to the patron of the program, Professor Rabindra Devnath, Vice President, West Bengal Pharmacy Council and CC member of the Pharmacy Council of India, and our chairman of the webinar, Principal Sir Dr. Kuntal Ajra. I wish to extend my deep appreciation to the Bharat Technology webinar team for their immense help, support, and dedicated efforts to neutralize and actualize the webinar series. While I can't mention each of on Bharat Technology team by name here, I hope that will take this a personal thank you. Thank you, everyone.
Now it's audible, sir.
Yes, audible.
Okay. Shall I continue, sir?
Yes, continue.
Okay. So myself, Vishnupada Vishwal, Assistant Professor of Bharat Technology in the Department of Pharmacognosy. I am your moderator and I will be moderating the whole session. Now, I am very much fortunate to be here to introduce our beloved chairman, sir, and regarding our institution. Our chairman, Professor Dr. Rabindra Devnath, sir, he himself an eminent pharmacy professional. He completed B.Pharm, M.Pharm from Sagar University, Madhya Pradesh, and his PhD from Jadavpur University, Kolkata, West Bengal. He is having so many years of teaching experience in different colleges across the India, in various private colleges as well as government colleges. He is having an experience of principal in government colleges at Tripura. Currently, he is holding a position of Vice President, West Bengal Pharmacy Council, and last but not the least, he is also an active EC member of Pharmacy Council of India. So this is a brief introduction about our beloved chairman, sir. He is having so many accomplishments. So due to the lack of time, I'm not going to describe all those things. So coming to our institution Bharat Technology, which is established in the year 2006 under the chairmanship of Professor Dr. Rabindranath Devnath, and also which is affiliated by Pharmacy Council of India, All India Council of Technical Education, and State Maulana Abul Kalam Azad University of Technology, West Bengal. Our college is running a Bachelor in Pharmacy course with a capacity of 100 seats, Diploma in Pharmacy course with a capacity of 60 seats. And moreover, I'm happy to announce that our college is the first college in the state of West Bengal to introduce a new course in Bachelor in Pharmacy, that is B.Pharm Pharmacy Practice course with a capacity of 40 seats, which is also affiliated by Pharmacy Council of India and also Macau Maulana Abul Kalam Azad University of Technology from this year onwards. My sincere thanks to all who have contributed their efforts to achieve this, and also simultaneously to our management. Our students have been participating in a lot of activities like health camp, attending seminars, conferences, and also recently during the lockdown period of time, they have also done a lot of activities like MAR activities, MOOCs, which is according to the AICT and PCI norms. Now, I would like to thank our convener, Dr. Biplav Devnas sir, for giving me this wonderful opportunity. Thank you, sir. Now, I would like to invite our today's chairman of the today's webinar to say a few words regarding this today's webinar. Over to chairman, sir, Professor Dr. Kuntal Hazra.
Good afternoon, all the participants. Respected chairman sir of this, respected patron, convener of this program, all of you. Good afternoon once again. So as our Biplav sir told, it is already reached 5,000 candidates for this webinar. This is really a great pleasure to listen these things. And we are eagerly awaiting from this topic, today's topic, modern approach to combat against cancer and diabetes. As we know that cancer, it is one of the second or third diseases which can take our life. Almost every 3 to 4 house you can see the cancer patient nowadays. And diabetes, you can see that almost every alternate house we can have a diabetic. So how to hold this, how to tackle this kind of disease? So we learned from these things from the Professor Wang. He is a very eminent speaker throughout the world. We are eagerly awaiting to listen from his mouth, and definitely Richa madam will tell about the industry academy interface. So where we are lagging, we are giving the best knowledge to our student. Bharat Technology, it was established from 2006. From that onwards, it is running successfully, and all the students, almost all the students have been placed in different organizations, and they are in the reach in their life. They goal their life. So still, where we are in the lagging, why still students are not able to able to do work in that industry? Why we are still lagging? That will be explained by our today's second speaker, Professor Richa madam. So without wasting time, I welcome these speakers, sir and madam. We are waiting. We are eagerly waiting to listen from your mouth. Thank you. Thank you.
Thank you, sir, for your valuable speech. Now, I would like to invite our chairman come today's patrons, Professor Dr. Ravindra Devnas sir, to say a few words. Over to chairman, sir. Please, sir, carry on.
I'm very much happy to know that our faculty members are organized such type of international seminar is very fitness in the time. We are having one professor from outside India and one from Risha madam from India. She is also PCA member. So Dr. Saurabh also to join in our seminar. In this seminar is very important in this aspect. The crucial time of the corona issue. So what human being cannot do? The teeny virus is shaking the whole world. So this virus is a very crucial virus. If we can study well, we can design well, the medicine should come out. Our pharmaceutical personnel, they are learned in all respects. They are in one time a biologist, one time is the architect, one time is a good engineer, and they have the thorough knowledge of the study of the medicines. So medicine will be coming out, thorough discussion, thorough research work throughout the country. More than 50 agencies are also working in India. So question is, earlier there was a disease identified cancer, earlier diabetes. Diabetes is already controlled. Cancer also going to be controlled. Cancer, some medicines are there, some measures are there. These measures to be updated, and day by day research work to be done for anti-cancer drugs, cancer remedy will be coming over. And last, last is the most crucial is the coronavirus. So now we have to determine ourselves. We have got the bread and butter for our livelihood, but we have to do something for the others who are suffering from such type of crucial disease. Diabetes one of them, and cancer also one of them, and in present coronavirus. God will create virus day by day exam. So we have the power to control, we have the power to kill them. That is, Rabindranath Tagore told, "মোরে আরো দাও প্রাণ, আরো দাও প্রাণ, মানে আমাকে আরো শক্তি দাও, আমাদেরকে আরো পাওয়ার দেওয়া যায়, যাতে এই ক্যালামিটি থেকে দূর করতে পারি, দূর করে হিউম্যান বিং যে মানব জাতির কল্যাণ হবে." On this auspicious occasion, I once again welcome our speakers, our participants from our institution, Kuntalajra, Biplov, and other Gunjan. They come forward with this online seminar, webinar seminar. It is very nice and very effective on these lockdown days. The lockdown days we are sitting idle. No, we are doing something for betterment of our knowledge, betterment of our institution, betterment of our country. So this motto should be well addressed. We welcome you for this one. Thank you.
Thank you, sir. We also not all need your blessings and cooperation. Thank you for your valuable speech, which is also touched everybody. And before inviting our today's eminent speaker, Dr. Wangsa, now it's my privilege to introduce our today's first eminent speaker, Dr. Tin Wei Wangsa, Professor, Non-Destructive Biomedical and Pharmaceutical Research Center, I Promise University, Technology, Mara, Selangor, Malaysia. Sir has obtained his PhD from National University of Singapore in the year 1999. He is presently the lecturer and researcher at the Non-Destructive Biomedical and Pharmaceutical Research Center, I Promise University Technology, Mara, Selangor, Malaysia. He primarily focused on particle scaffold design for oral, transdermal, and pulmonary drug delivery, development of novel non-destructive pharmaceutical analyzer, as well as design of pharmaceutical processors for innovative dosage form from manufacture. He has published over 110 peer-reviewed articles. He is the editorial board member of Asian Journal of Pharmaceutical Sciences and associate editor of Drug Development and Industrial Pharmacy and Drug Design Development and Therapy. He is the regional editor of Current Drug Delivery, co-editor-in-chief of Patents on Drug Delivery and Formulation, and has served as the reviewer for more than 90 international journals like International Journal of Pharmaceutics, ACS, applied materials and interfaces, expert opinion on drug delivery, pharmaceutical research, and nanoscale. Professor Wang is the advisory board member of Outstanding Scientist, Jury, and lead judge of for several international conference and innovation awards like Maurice Mary Janet Award, Tefako Innova Pharmatech Scientist Award, Malaysia Technology Expo Innovation Award. Now, with this, I would like to invite our eminent speaker, sir. Please, sir, carry on. Thank you, sir.
All right. Thank you for the kind words. Allow me to share the screen first. Just hold on. Something.
Gauranga, sir.
Is there someone sharing at the moment? Because I cannot go in. Let me see.
Gauranga, sir, please help him. Hello.
Hello?
Gauranga, sir, please help him.
Is there someone blocking the sharing?
Gauranga sir. Wait, sir, just a minute.
Oh, participant. Yeah. I cannot share the file. Let me see.
Sir, please try again.
Okay. Okay,
Yes, sir, got it?
got it. Can you see the slide?
Yes, yes. Like,
Yes, yes.
Yeah. All right. So, good afternoon, good evening in Malaysia. First of all, I wish to thank the chairman and Dr. Diplat, and also the organizing committee for your kind invitation and arrangement of this webinar. So today, I'm going to share with you innovative strategy in oral, pulmonary, and skin drug delivery for cancer and diabetes treatment. I have been presenting in India, mostly on skin drug delivery. So if you happens to be the former participants, just bear with me. Now, following skin drug delivery, I will move on to oral and pulmonary, and hope that that can give you some new insights to the current innovation. So I have switched on my WhatsApp, and Dr. Diplat has my mobile number. So if there's any interruption, feel free to WhatsApp me if these Zoom meetings fail to work, right? So I'll move on to skin drug delivery as our first topics of presentation. Now, cutaneous melanoma is one of the common and most aggressive skin cancer. Now you can see from the surface morphology, now it's due to it's a dark pigmentation. Now it may occur from epidermis, and with time, actually the cancer can grow inwards and penetrates to upper dermis and the lower dermis, and later on metastasize into the bloodstream. So this is one of the very risky and dangerous skin cancer. So many therapeutics have been used for the treatments of cutaneous malignant melanoma. And I wish to highlight to you one conventional drug, which is rather inexpensive. That is 5-fluorouracil. So this drug has been lately being undergoing a clinical trial, and it has been proven useful against cutaneous melanoma, right? So 5-FU has been one of the drugs candidates potentially to be used in topical local therapies of cutaneous melanoma. However, delivering drugs through the skin and into the melanoma cancer cells faces a few challenges, primarily the skin barrier and also the melanoma cellular membrane barriers for drugs penetrations and delivery. So on this note, today I wish to discuss what are the innovative strategies that have been taken by us to overcome these barriers. Now we first look into skin barrier and skin drug delivery. Now basically the skin is constituted of epidermis, dermis and subcutaneous tissue. Now the top layers of epidermis, which is known as a stratum corneum, this is a very robust barrier and is the main hindrance to all the drugs and molecules transport. And for pharmaceuticals, generally we know that the drug molecule can be transported across the skin, either through diffusions across the epidermis or stratum corneum, or it may be transported through hair follicles as well as the sweat gland. But knowing that hair follicle and sweat gland only occupy 0.1% of the total skin area. So as such, for pharmaceuticals and pharmaceutical technologies, commonly we regard drug transport through epidermis and stratum corneums represent the main routes of diffusions. So now let's take a look on the stratum corneum's physical construct. Now this stratum corneum basically is a very systematic and orderly arranged structure, which is known as bricks and mortar. Now it consists of a keratin-rich corneocyte arranged systematically in this pink color lipid matrix. Now, if you look closer at the lipid matrix, you will realize that this lipid matrix consists of aqueous pore alternating with lipid bilayer. Now, this lipid bilayer is made of cholesterol, fatty acid, and ceramide. So I wish to highlight to you, despite lipid layer is lipidic, it does have some polar moiety. For example, ceramide is made of OH, carbonyl, or NH moiety. So even though it's polar, non-polar, it does have some polar characteristic. So transportation of drug across the skin generally is mediated by two routes, transcellular and intercellular. Now, if you look at the transcellular route, transportation of drugs needs to go through layers after layers of corneocyte. The drug needs to diffuse across the lipid, go into the corneocyte, leaving the corneocyte, go into another corneocyte. So these routes of drug transportation is rather challenging and difficult. Now, what about intercellular routes? Now, the drugs basically go through the aqueous pore or through the lipid bilayers, and from there it can diffuse across the stratum corneum and reaching the lower epidermis. However, if you look at the pathway of intercellular route, it's rather tortuous. It's a lot of twist and turn, so it's not easy for the drugs to transport across. So what is the general idea in order to promote skin drug transport? Very simple. Basically, we need to disturb reversibly and transiently the stratum corneum. In other words, we need to damage them reversibly. So to enable the drugs to be transported across the skin, and hopefully later on the skin will heal by themselves, right? Otherwise, the toxic chemicals will follow upon. So over the past 30 years, various technology and techniques have been adopted in skin drug delivery. Now you can see that broadly is classified as passive and active technology. Now the passive technology has hydration. We can hydrate the skin, and the water molecule can actually penetrate the aqueous pore, and that will actually engorge or enlarge the aqueous pore. Now, with the larger aqueous pore, more drugs can penetrate across the stratum corneum. We can also formulate our skin medicine using chemical penetration enhancer, such as oleic acid, ethanol, and surfactant. Now, these chemicals are able to fluidize the lipid bilayer, or they may even extract for example, ethanol, they can actually remove and extract the lipid bilayer, thus making the intercellular aqueous pore larger, enable more drugs to go through the skin. Now, of course, nanocarrier is one of the favorites topic of many scientists, especially the pharmaceutical technologists. Now, the nanocarrier can be made from water. It can be made from oleic acid, ethanol, and surfactant. So they have the ability to fluidize and extract the lipid bilayer, making larger aqueous pore for drug transport. Now, the nanocarrier itself, as the name suggested, they are small. They have a very small geometry. Thus, by themselves, they should be able to penetrate across the skin and bring the drug along into the skin. Now, what about active technology? Stratum corneum removal using the 3M adhesive tape. This is a very traditional method. Microneedles, where we porosify the skin by needles, and ionto electrophoresis, poration. There is the electrical method to charge the skin, to shock the skin. Sonophoresis is the ultrasound. We also have photomechanical wave and pressurized gas. Now, in today's context, for transdermal scientists, we commonly advocate combination technique. We first treat the skin with active technology, followed by the passive technologies such as nanocarrier. So this is the general approach of today, either for the industry or transdermal scientists, to deliver the drugs across the skin. Now let's take a close look on how the nanocarrier deliver the drug across the skin. Now, there are a few mechanisms. First of all, upon applications of nanocarrier onto the skin, the nanocarrier can release the drug on the surfaces of the skin, and the drug later on diffuse across the skin. Alternatively, the nanocarrier may be fused with the stratum corneum and release the drugs from the upper part of the skin. Of course, the last method, nanocarrier being small, it may be able to penetrate through the intercellular routes and bringing the drugs across the skin and release the drugs later on in the deeper layers of the skin. So the drug transport by the nanocarrier through the skin generally is dependent on the size of the nanocarrier as well as zeta potential of the nanocarrier. Now, however, the relationship is not straightforward. Now, generally, we will assume that smaller the nano size, there may be larger amount of drugs being transported across the skin. This is true to some extent. Now, you can see that for nanocarrier that is small, there are a lot of nanocarrier has a very low drug transport. In fact, larger nanocarrier may have a better drug transport across the skin. So the relationship between the size of the nanocarrier versus the drug transport propensity is not straightforward. Now, what about zeta potential? That is the surface charges of the nanocarrier. Now, you can see that for vesicular carrier, such as liposome, transposome, polymersome, and attosome, there's no direct relationship between their zeta potential with the drug transportation across the skin. However, for nanoemulsion, we found out negative 20 millivolt seems to be favorable surface charges to enable the nanoemulsions to bring the drug across the skin. Now, for polysaccharide nanoparticles such as chitosan, alginate, and pectin nanoparticles, both positively charged nanoparticles and negatively charged nanoparticle can promote skin drug transport better than the neutral drug particles. Right? Now, this is not difficult to understand. Now, for negatively charged nanoparticles, it can actually repel the skin anionic lipids. So as a result, the lipid bilayers of the skin will be fluidized. The aqueous pore of the skin may be enlarged, thus allow more drugs or even the negatively charged nanoparticle to go deep into the skin. Now, for positively charged nanoparticles, being positively charged, it can attract to the anionic lipids of the skin easily. Hence, this positively charged nanoparticle can be transported across the skin very easily through a simple rule, that is the opposite charge attract. right? However, looking at the physical chemical attribute of nanocarriers, such as size and zeta potential, you will see that to transport the drugs across the skin by nanocarrier is heavily dependent on the physical chemicals properties of the nanocarrier. So somehow this is undesirable. So commonly we combine passive technology such as nanocarrier with active technology such as microneedles, the electrical ultrasound method, with the hope to reduce the dependence on the physical chemical properties of nanocarrier. So upon treating the skin with active technology, we hope that more nanoparticles can bring the drug across, and preferably independent of their size and zeta potentials, right? Hence, there will be less hindrance and less hurdles to bring the drug across the skin. So in our laboratory, we have been using microwave in our pharmaceutical research. Now, in the year 2000, we actually engaged microwave to modify the solid medicines such as tablet, solid bits, pellets, solid microparticles, so to modulate the drug release kinetic. So what we have found is that the microwave is able to interact with polysaccharide, protein, and lipid materials of the pharmaceutical dosage form. It can actually, for example, promote the conformational flexibility of all these polymers. So with that in mind, we actually suspect perhaps microwave can do the same to the skin. Now, as I have illustrated earlier, the skin basically consists of proteins. Also, it consists of a lot of lipids. So microwave may be able to interact with them and hence modify them to some extent to enable larger aqueous pore formation, and more drug can then go through the stratum corneum and into the deep skin. So with that hypothesis in mind, we actually do a little bit of reading. Now we realized that in the medical field, using microwave is rather common. Now microwave of 900 to 2500 megahertz has been used for treatment of cancer, such as bladder, rectal, and prostate, and also has been used to relieve the joint stiffness, and also for some deep tissue heating. And microwave is also been found in the medical research, whereby it can actually eradicate Staphylococcus aureus, and hence it will be useful for wound healing. Now, what about for us? Now, in the early 2000s, we used the microwaves to modify the solid medicine via its ability to heat, elasticize, induce cross-link, coagulation, denaturation, or amorphization of drug crystal. But the microwave condition that we use is rather harsh. The intensity range from 80 to 975 watt. Duration can be as long as 60 minutes. And it could involve multiple cycles of microwave treatment. Now, all these conditions definitely will be unfavorable if we use microwave as the active technology to treat the skin before the applications of nanomedicine. So on this note, we first carry our homework. So we realized that if we would like to treat the skin with microwave, the microwave exposure limit should be kept below 1 milliwatt per cm square. And the higher frequency microwave is preferred. Now, being higher in frequency, they have the lower wavelength. It means that the microwave will stay on the surfaces of the skin rather than penetrating deep down into the distant organ and affecting the organ. And of course, we will try to keep the durations of the microwave treatments as short as possible to avoid any heating or charring. So with this in mind, we actually have carried out some simple experiment. Now we treat the rat skin with microwave from the upper surfaces, in the directions of the epidermis. Now what do we note is that treating the stratum corneum or the epidermis with microwave of the specific frequency, such as 2450 megahertz, for a specific duration, such as 5 minutes. Now you realize that the skin turns smoother. Now what does it mean? It could mean that the systematic structure of the bricks and mortar may have collapsed upon treating the skin with microwave. Now, this sound an alarm that microwave perhaps can be used as a tool to modify the skin to enable drugs delivery via the skin. So with all these findings and readings in mind, we then move on to initiate an anti-cancer drugs project. Now in this project, we intend to deliver 5-fluorouracil, which has been received some positive clinical trials in anti-cutaneous melanoma. And 5-fluorouracil, although it is small, but it is polar. So it's very difficult to go through the skin, right? As such, we wish to formulate the 5-fluorouracil in the form of a nano carrier attosome, and perhaps in combination with the active technology to promote local drug retention for local treatments of cutaneous melanoma, right? So we wish that more drugs can be accumulated in the skin and less drug or minimal drugs are appearing in the bloodstream in avoidance of a systemic side effect. So we prepared 3 types of attosome, E5, E10, E15, with a content of ethanol from 5% to 15%. Now you can see that with higher content of ethanol, the drug release tends to be faster, and the systemic penetration of the drug is greater than that of attosome containing 5% of ethanol. So it appears that attosome with the lower content of ethanol at 5% is favorable. First, it induces a lesser rise in the systemic circulations of 5-fluorouracil. Second, it actually promotes local skin drug retention, which is what we want in order for a local therapy for cutaneous melanoma. Now, characterization of the skin by phototransform infrared imaging. Now, it tells us that E5, being lower in ethanol content, you can see is able to be accumulated in the epidermis compared to E10 and E15, whereby the attosome may be penetrated through the epidermis into the dermis, followed by the bloodstream, right? So this is undesirable when systemic toxicity is concerned. Now you may wonder why E5 tends to be accumulated in the epidermis. Now this is because they are larger in size. Although they are nano and able to penetrate into the skin, but they could be larger in size, and hence transport across into the lower dermis is less favorable. And also the E5 is more negatively charged. So they have an ability to soften the skin, to allow more drugs and attosomes to go through, but being negatively in charge, especially of a higher negatively charged, so it will be less favorable to reach the lower dermis and into the bloodstream. So for this reason, E5 tends to accumulate in the epidermis. So this is suitable for local cutaneous melanoma treatment. So to enable us to further improve the formulation, now you may question, why not we prepare E1 or E2 with even lower percent of ethanol? Now the answer is no. Using a lower contents of ethanol, the attosome may not be that elastic. So it will be hard for this rigid attosome to squeeze through the intercellular pathway and into the epidermis. So on this note, we then combine the attosome with microwave. Now we first treat the skin with microwave and followed by the application of drug-loaded attosome. Now what we have found is that treating the skin with microwave at 2450 megahertz for 2.5 minutes, you can see it brings a very minimal rise in the systemic drugs, but it actually promotes accumulation of the drug in the skin. So in short, we have succeeded in further promoting local skin drug retention through combination attosome and microwave technology. So this is another Fourier transform infrared imaging, combination attosome 5 with microwave treatments of the skin. You can see a lot of attosome and drugs are actually located in the epidermis, which is useful for local therapy. So we may wonder what exactly happens to our skin upon treatment by microwave, followed by the applications of Ethosome. So on this curiosity, we actually conduct characterization evaluations on the skin. We evaluate the lipid region and protein regions of the skin, as well as, epidermis and dermis layers of the skin. Now, allow me to use the schematic diagrams to illustrate the concept instead of going through the reading, which I think will be quite confusing. Now, earlier slide I have indicated. Now, stratum corneum basically made from keratin-rich corneocyte, arranged systematically. Now, in between them, we have intercellular bilayer lipids, as well as aqueous pore. And stratum corneum is supported by epidermis and dermis. And in the dermis, we do have extracellular subproteins like elastin or even collagens. So treatment of the stratum corneum of the entire skin by the microwave will lead to changes in microstructures of the skin. The first thing happen is that the alpha helix keratins will transform into the beta sheets keratin. Okay, so this will result in keratin condensation. Now, with the condensation of keratin, the entire corneocyte will shrink in size. So when the neighboring corneocytes are shrinking in size, the intercellular pathway become larger. Now, in addition, the microwave can also interact with the intercellular lipids. It may be able to fluidize them. So the combination effect, we may have a larger aqueous pore, or we may have a larger intercellular routes for the Ethosome or for the drugs to be transported across. Now, simultaneously, microwave being a radiation that hit in a volumetrical manner, you will see that the microwave can actually penetrate deep down into the dermis at a very fast speed, compared to Ethosome, which is a liquid dosage form. Now, this microwave, through the FTIR and DSC finding, so we found out and sort of speculate that it may be able to promote swelling of the extracellular protein. Now, this protein, upon swelling, acting as the barriers. So on this note, Ethosome and drug can penetrate through the stratum corneum into the epidermis and the upper dermis, but it may not be able to go further down to other parts of the dermis and systemic circulations. So all in all, the drug and Ethosome will be locked in the epidermis rather than going into the deep dermis and systemic circulation. So through this thermal analysis and infrared analysis, we can then come to a conclusion that combination Ethosome and the microwave technology can actually promote local drugs retention for topical therapies of cutaneous melanoma. Now, to further concrete the evidence from the in vitro findings, we conduct some in vivo study. Now, you can see that treating the rats with microwave on the skin, followed by the application of drug-loaded Ethosome on the skin, the plasma drug level does not appear to be high compared to rats that are treated with just Ethosome per se, right? So you could see that treating the rats with combination Ethosome and microwave promote local skin drug retention, and they can actually reduce or minimize the systemic penetration of the drug. So this will be highly favorable for local therapy in avoiding the systemic side effect. Now, what about melanoma? Now, upon having drugs or Ethosome able to penetrate the skin barriers, now the second hurdle is the melanoma cell barriers. What we have noted is that microwave by itself, it seems to be able to exert some cytotoxicity against the melanoma cell line, similar to that of Ethosome. And combinations of microwave Ethosome in treatments of the melanoma bring about a higher level of cytotoxicity. So it appears to us that there's some synergistic effect. And we move on to thermal analysis and infrared analysis of the melanoma cell line. So we wish to see what happens to the melanoma cell line. So it appears that attosome or microwave, they can actually fluidize the lipid regions of the membrane of the melanoma. Now, this in turn will encourage or promotes the entry of attosomes into the melanoma cells and exert a higher level of cytotoxicity. Now, the combinations of microwave with attosome greatly fluidize the lipidic zones of the melanoma membrane through interacting with the phosphate moiety of the membrane. And this brings about a high level of attosome entry into the melanoma cell line and a greater extent of cytotoxicity. Now, the infrared and the thermal analysis result is further supported by the confocal electron microscopy data. Now, this is the melanoma cell line. You could see that if we treat the melanoma cell lines with microwave, followed by the application of a drug-loaded attosome, now a higher extent of attosome is entering into the melanoma cell line, thus raising a higher level of cytotoxicity. And using the same cell line and with confocal electron microscope analysis, we actually perform some preliminary treatments of the cell line using cropamazine, nystatin, genistein, and wartmanins in order to elucidate what is the endocytic pathway of attosome. So our conclusion is that the microwave appears to promote the endocytosis of attosome into the melanoma cell through the lipid raft pathway. So it's not surprising that microwave can interact with lipid. As I've indicated earlier, now the lipid is not necessary to be apolar. It does have some polar moiety that can attract the microwave affinity. Now, having done with attosome in the form of a liquid dosage form, in another study, we actually move on to solid nanoparticles. Now, we prepare chitosan 5-fluorouracil conjugate nanoparticles by means of a covalent reactions. And these nanoparticles is obtained through spray drying. So they are solid in nature. Now you could see the similar observations have been obtained, whereby treating the skin with microwave for a specific duration will allow more nanoparticles to enter into the skin. And we realized that the chitosan's nanoparticles actually fluidize the palmitic acids of the skin, whereas the microwave fluidize the ceramide 2 regions of the skin. So on this note, this can then aptly explain why combination of microwave and chitosan nanoparticle can bring about a synergistic drug delivery across the skin, because they actually fluidize lipidic domains of a different lipidic of the different lipid content. Now, in another project, apology is too small. We actually prepare chitosan 5-fluorouracil folate conjugate nanoparticles. Now, folate is used because folate is a targeting ligand that has a high affinity for folate receptor expressed on the surfaces of the melanoma. Now, using folate and incorporating the folate into the chitosan 5-fluorouracil nanoparticles, we do have enhanced skin drug retention, and the nanoparticles is entering into the melanoma similarly through the lipid raft pathway. And through using folate as a targeting ligands, now this nanoparticle, in addition to be used for topical therapy in the skin, it may be useful for systemic treatments of metastasized cancer. So with the intentions in future, using this nanoparticle for systemic treatment in addition to local therapy, we then try to identify the optimal folate content that is needed in order to maximize the entry of nanoparticles into the melanoma. So this is one of our latest work that we have done. So we have found out about 20% of folate content is desired with respect to the dry weight of the nanoparticles. Now, in addition to in vitro experiment, we also carry out some computational modeling. So we found out that with a folate content of 20%, the entire nanoparticle has the right hydrophobicity, hydrophilicity balance for them to interact with the membrane of the melanoma and being endocytosed. Right? Now, in another project with respect to skin drug delivery, we actually try to deliver insulin, which is very popular drugs for diabetes mellitus through the skin. So the general conclusion is that the microwave is able to promote transdermal insulin delivery. If we treat the skin with microwave, followed by the application of insulin, you will see there is an enhanced extent of insulin penetration into the blood. Whereas fatty acid, such as oleic acid, linoleic and linolenic acid, instead of promoting transdermal insulin delivery, it actually demotes transdermal insulin delivery. So if you have been formulating skin medicine, you should realize that fatty acid is the most common chemical penetration enhancer for skin medicine. However, fatty acid fail in insulin delivery across the skin. Now, what is the reason? So through a series of experiments, which I'm not going to show you here, now we found out because microwave is residual free, it can actually affect the skin structure without leaving any chemical residue. Unlike fatty acid first needs to penetrate into the skin before it can change the skin structure and promote insulin delivery. Now, having fatty acid embedded in the skin, it can actually form a lipidic shield or lipidic barrier, thus repelling the polar insulin. So the polar insulin will have a difficulty to undergo diffusion process into the skin because of the fatty acid that we use has formed a hydrophobic shield, right? So this is the findings we have obtained today, so in year 2020. Now, what about inhalation drug delivery? Now, what is the innovations that we have in our lab? This is one of our recent projects, and we have a sort of a secure grant lately. And basically what we did is very simple. So we would like to administer nanoparticles into the deep and peripheral lung for treatment of lung cancer. And obviously these nanoparticles is made from a polymer or oligomer matrix conjugated covalently with the drug. It is also conjugated covalently with the folate, which work as a targeting ligand. But the issue with nanoparticles inhalation is that nanoparticle can be inhaled, but it will be exhaled very soon and very fast. So on this note, delivery of nanoparticles into the deep and peripheral lung is a great challenge. So what are the common strategy or the past strategy in delivery of nanocarrier into the lung? But the nanocarrier has been made into agglomerate, composite, or they are even being microencapsulated in the form of microparticles. But this brings about several disadvantages. Now, first of all, this nanoparticle is poorly redispersed. Second, the nanoparticle may not be able to release to the target site, right? Hence, there will be inadequate drug action. And you can see if we microencapsulate the nanoparticle size or shape, it may be distorted, hence losing the size-dependent biological responses. So these are the some disadvantages of the current mode of nanocarrier delivery into the lung. So what we do is we have a few plans. Now, first of all, we actually sort of a brainstorm. If we have the nanoparticles, is blend with the coarse microparticles, such as coarse lactose particles of 200 to 300 micrometer in size. This will be unfavorable. Now, why? Upon inhalation of this big structure, should the nanoparticle fail to detach from the lactose, the deep and peripheral lung may not receive the nanoparticles and the drugs because few hundred micron size lactose is not able to go down to the deep and peripheral lung. So on this note, we actually create a project. So we hypothesize that we should actually reduce the lactose size into just less than 2.5 micron. And we attach the nanoparticle onto these micro scale lactose particles. So what will happen upon aerosolization and inhalation? Now you can see that nanoparticles by themselves, they are small, they have larger specific surface area, so they are very cohesive. Now micro scale particles of about 2 to 5 micron in size, they are also agglomerated. So if we can blend these two together in a specific weight ratio, you will see the nanoparticle will attach onto the surfaces of the microparticles. This will then reduce the agglomerative potential of the microparticles. Now, at the same time, it also reduces the cohesivity of the nanoparticles. So the foam mixture is actually a powder of great flowability. And this will enhance aerosolization and inhalation. And being small in size, either the lactose microparticles or nanoparticles, they will be able to reach the deep and peripheral lung, right? The nanoparticle will be released in the peripheral or deep lung. Even though they are not released, they can still arrive at the destination, unlike when 200 to 300 micrometer lactose particles are used. So on this note, to prove our hypothesis, we prepare 6 variants of chitosan nanoparticles through changing some acetic acid concentration, the chitosan molecular weight, chitosan concentration, using some excipients such as twin span and ethanol. And we characterize this nanocarrier: size, zeta potential, size distribution, circularity, which is the roundness, surface roughness, and the crystallinity of the nanocarrier. Now, all these parameters are essential to be characterized because they will dictate aerosolization and inhalation capacity of the nanocarrier. You can see this nanocarrier is generally round in shape. And we also prepare our own lactose microscale particles. Now, in this case, you can see we are actually using lactose PEG 3000 microscale particles. Now, the lactose PEG 3000 is used, or PEG 3000 is used because it can reduce the hydrophilicity of the lactose, thus making the microscale particles being more stable. I wish to highlight, if you can see the size is rather small, it's only a few micron. Right, and we then blend the nanoparticle with the microscale particle, and we run the cascade impactions analysis, which is a simulated lung study. And we found out nanocarrier size, zeta potential, and circularity dictate their aerosolization and inhalation capacity. Now, let me use a schematic diagram to illustrate to you. Now, this is the microscale particle and this is the nanoparticles. So nanocarrier that is larger with higher zeta potential or rounder that tends to interact with the microscale particles, and these microscale particles will bring them into the deep and peripheral lung. But for nanocarrier that is smaller, they have a larger specific surface area to interact with each other and become very clumpy and agglomerative, or lower zeta potential, whereby they have reduced charge repulsion, they can clump together easily, or those of the less circular or less round, they can actually have frictional interlocking between each other. You can see that this nanoparticle tends to adhere to themselves rather than adhere onto the microscale particles. So on this note, such nanocarrier have a lower propensity to be aerosolized and inhaled into the deep and peripheral lung. We also prepare a liquid dosage form for inhalational study, nanoemulsion in this case. Now we have prepared 3 generation nanoemulsion, first, second, and third generation. Now the first generation has the drugs suspend in the oleic acid globule. Now the second generation we decorate with chitosan. Now chitosan is used because it has the affinity for mannose receptor of the macrophages in the lung. The third generation we decorate with chitosan folate conjugate. Now folate itself is also a targeting ligand for macrophage. So the difference between second and third generation is that this is the single receptor targeting, whereby chitosan folate conjugate will introduce dual or double receptor targeting to the alveolar macrophage, right? And our conclusion of the study is that if we exert dual targeting, so you will see that there are more particles or more drugs are able to enter into the macrophages, and the entire drug accumulation in the lung will be higher, because the dual receptor targeting enable closer binding between the nanocarrier and the alveolar macrophages. Hence, more drugs can be retained in the lung for treatment of the diseases. Now, comes to our last part, which is oral drug delivery. Now, this is one of the very new concept whereby we actually create in vivo coating instead of using equipment such as fluid bed or immersion coating. So the entire coating process happens only in the animals or in the patients. So in this anti-cancer projects, apology because here is a prayer time. So what we did is we have the pellets. Now these pellets is made from pectin, microcrystalline cellulose, as well as 5-fluorouracil. And this pellet is mixed with the coating material, which is ethyl cellulose and pectin in the capsule. Now, upon ingesting this capsule, now the biological fluid will actually wet the pectin in the coat material. The pectin will swell and turn sticky, will bind the ethyl cellulose and the pellets together to form a robust plaque. Now, this plaque is very hard to dissolve. Hence, the drugs can survive from gastric into the small intestine, right? Now, upon reaching into the colon, now what happened is that colon has the microbial enzyme that can digest the pectin. Now, these microbial enzymes such as pectinase, they can actually digest the coat pectin. They can also digest our pellets pectin, thus eliciting drug release specifically in the colon. And this will be ideal for the treatments of a colon cancer. So we have conduct physical, chemicals, biological, as well as in vivo study. Now this in vivo coating method is very ideal and very perfect for colon cancer targeting through oral administration. It can actually reduce the size and number of the cancer, and it can also lower down the histopathological grade of the cancer. But what I wish to show you today is that if we intracapsular coat the pellets, the aberrant creep foci number actually decrease upon oral administration. Now, this aberrant creep foci is actually a precancerous lesion. Now, this precancerous lesion is not yet a cancer, but it is potentially to be transformed into cancer. So using such a system, not only cancer is being targeted, the precancerous lesion, which is called aberrant creep foci, is also being eradicated. So in another studies, instead of coating to elicit colon drug delivery, so what we did is we try to figure out, is there any possible method whereby matrix without coating can deliver the drugs to the colon for treatments of the colon cancer or colon inflammation. So in this study, from the judicious choice of the excipients, we can actually deliver the drugs to the colon without any coating. So the basic functional ingredient is alginate, which is polyanionic polymers. And we have a calcium phosphate, which is a moderately water-soluble calcium salt, and ethyl cellulose, which is a hydrophobic polymers. Now, this calcium phosphate being moderately water-soluble, it dissolves slowly to cross-link the alginate. And because this calcium salt dissolves slowly, it doesn't expel the ethyl cellulose away from the pellets. As such, in this structure, we can have both hydrophobic ethyl cellulose as well as hydrophilic calcium alginate to sustain and delay the drug release until when the dosage form is reaching the colonic region. Now, if we use calcium acetate instead of calcium phosphate, a different scenario may occur whereby calcium acetate being highly water soluble, it will rapidly dissolve in the gastric media. And this will expel the ethyl cellulose away from the pellets. Then pellets losing the hydrophobic effect will not be able to sustain the drug release till the level of colon region. So this is one of our study. We have also conducted some preclinical pharmacokinetic study using the specially designed pellets. You can see we can actually delay the drug's absorptions into the bloodstream. And this is SCM and histopathology study. Now, the rats that has the inflamed gastrointestinal tract, upon treating with pellets, it heals at a faster extent compared to those administered with prednisolone or those without any treatment. So this will be my last two slides. This is also one of the recent work whereby we orally deliver the insulin. So with the hope that this can circumvent the current unfavorable administration route, which is injection. You may also know that inhalation insulin does not do very well. So I believe that oral insulin has an opportunity for us as the researcher to have a new breakthrough and perhaps for us to involve in commercialization of oral insulin. Now, to be able to prepare oral delayed release insulin, I think a lot of protection is needed for these protein drugs. So what we did is we first actually prepare alginate insulin nanoparticles. However, if we use the pure alginate, they will form a very robust complex. And this complex will not even release, whether it is in gastric, intestinal, or colonic region, or even in the cellular compartment. Hence, we actually modify the alginate. We actually covalent conjugate the alginate with carbon 18. And this alginate carbon 18 is then complexed gently with the insulin to form the nanoparticles, right? Now, this nanoparticle is embedded in calcium alginate bits, which is millimeter in size, that are able to have a reduced surface area for drug dissolution. And this bit is further coated by a protective layer, which is made from chitosan oleic acid conjugate. Now, we use chitosan oleic conjugate instead of chitosan alone, because chitosan is cationic polymers. It will erode very fast in the gastric region. So through the introducing of the oleic into the chitosan, we can exert hydrophobic effect, and hence this coat will not be eroded that fast in the gastric region. So you can see the complexity of the dosage form design. So we have the coat, we have the calcium alginate, and we have the alginate nanoparticles to protect the insulin within. So these structures is able to deliver the insulin into the blood at a greater bioavailability, and also promotes blood glucose lowering to a greater extent, right? However, I wish to highlight to you, if you look at the drug release curve, you will realize that in the intestinal region, only about 30% of the insulin are released. So majority of the insulin are actually still being captured in the nanoparticles. And this nanoparticle is being released from the calcium alginate upon the dosage form reaching the intestinal region. Now we actually verify it through using synthesizer analysis. From there, we will know that whether the nanoparticle has been released or not. Now, these nanoparticles is envisaged to be able to cross the mucosa, to cross the mucus, and reaching the mucosa and enter into the intestinal mucosa prior it reaching into the systemic blood circulation. And the transportations of nanoparticles through the intestinal mucosa is mediated through clathrin and calvular pathway in general. So this is our findings, the latest finding for oral insulin. So we are still planning for some more work and with a better design, looking at both scientific aspect as well as commercialization. Okay, so with that, I actually reached my end, and before that, I wish to to introduce you about our latest program, which is Malaysia Technology Expo Special Edition. So we actually welcome submission in the form of abstract and video, or it could be PowerPoint slide or photos. We wish to identify the best innovations of the world that address the COVID-19 issue. So this submission is open not just pharmacy, but to medical, dental, nursing, engineering, social science, business, accountancy, and either academician or industrialist of all field. So I will later pass on a PDF file to the organizing committee. Or if you are interested, you can actually write direct to me. So this is my email address. Then I will pass you a PDF copy for you to take a look. So basically, it's just my name, small capitals, @yahoo.com. So with that, I end my presentation. I wish to thank the organizing committee of Bharat Technology, my university, my postgrads, postdoc, and all the supplier and manufacturers. So if you have any questions, please feel free to ask me. Thank you. All right. Hello.
Yes.
Okay. All right. There are some questions. Is our microwave in the kitchen causes any harmful effect? Yes. We cannot use our kitchen microwave because our kitchen microwave range from 80 watts to 1,500 watt. So the microwave that I use is precision microwave. It is only 1 milliwatt. So it's very different. So the microwave that we use is only 1 milliwatt. And the exposure intensity to the skin is 0.14 milliwatt per cm square of the skin. So you can see the level of microwave is very precise, but of a very low intensity. The second question is there any change in the structure of normal cells during prolonged therapy or any toxic effect? I have done an acute toxicity study either on the skin, on the kidney and liver. It appears not having any major effect. But I have not conducted any prolonged or chronic study. Now let's look at our mobile phone. Now the microwave level that I use should be less than your mobile phone. And knowing that most of the young generation are speaking through mobile phone for 2 hours continuously, with the phone pressing against the ear. And my questions to the FDA or to the government is that if we can approve mobile phone usage, or why not microwave technology for skin drug delivery? So this is my, how shall I say, this is my argument. So I feel that it is safe. Yeah. Of course, we are living in a complicated world. You may ask me, smoking causes lung cancer, but why government allow cigarettes to be sold in the country? So this question, I do have the answer because I work in the government sector, either in Singapore or in Malaysia. So human is actually a lot of things are created by human. Yeah, I'm not here to tell you who is wrong or right, but we have the answer, and hopefully one of us will pursue and to stop certain things that has been happening in the world. So what are the implications of microwave technology in transdermal drug delivery? And what is the device you? Okay, the device that I have now is not meant for pharmacy. It's meant for semiconductor engineering. So this project is actually initiated in year 2008. So at that time, when I first looked at the engineering equipment, I was wondering if it can be applied for pharmaceutical application. So through these 10 years of study, it appears that yes. But this engineering equipment is expensive. So if we would like to commercialize the technology, we need to reinvent the equipment into a simpler version. Yeah. What is the current status of research using artificial intelligence? I'm not in this area, but artificial intelligence is in our life. We are trying to venture into the artificial intelligence. And in the case of mine, I look into the oral medicine versus artificial intelligence. So any question that perhaps I can help?
Sir,
Hello.
hello, Dr. Mojumdar sir.
Hello.
Hi.
Mojumdar sir,
Hello.
continue.
Yeah.
Hi.
Thanks a lot, Dr. Wang, for your informative presentation.
Oh,
My question is, particularly in the Asian continent, there are the growing tendency of using fairness cream. So in respect to the cutaneous melanoma, how far these creams are safe? Rather, does these formulations increases the chances of cutaneous melanoma or not?
Sorry, I cannot catch the second sentence.
Does this sort of fairness formulation increases the chances of cutaneous melanoma?
You mean does the? Do you mind rephrase again? Sorry, I cannot hear very clearly.
Yeah, thing is that in our Asian continent, people are using fairness cream.
Fairness cream. What is fairness
Yeah.
cream? Hello, hello.
Hello.
Can you repeat fairness cream? I don't understand what is fairness cream.
Fairness formulation cream.
Oh, cream.
Cream formulation.
Yeah.
Okay.
Cream formulations.
Okay.
Does that increases the chances of cutaneous melanoma? This is my first question. And the second question is, as you have told that you are using pectin for colon targeting, and we know that methoxylation of pectin is an important factor for using pectin as a carrier. Around, as per my knowledge is concerned, around 59 to 67% methoxylation is more effective. So how much percentage of methoxylation you have used for your formulation? Thank
Okay.
you.
I think for the cream, if you have parabens, I think nowadays, for example, European, they have banned it. So suspected may cause breast cancer. So I think cream formulations, whether they will elicit cancer is all depending on the ingredients. Now about the pectin, if you realize that in the lectures, I have pectin in the pellets. I also have pectin as the coating materials. So I use two different types of pectin. Now the pectin in the pellets has more than 50% of methoxylation. So that try to introduce a more hydrophobic influence. And the pectin as the coat materials is less than 50% of methylation. So hopefully it will be a little bit more hydrophilic. It will be easier for them to act as the adhesive, binding the pellets and hydrophobic ethyl cellulose together.
Thank you. Thank you.
Yeah. There's a question between polymeric microwave targeted drug delivery system and microneedles for gene release. Which one will be better? Okay. Recently, I also embarked on the siRNA work. Now, let's put the drug aside. Let's compare microwave versus microneedle. What are the pros and cons? So microneedles, I think, should be quite safe, but the cost could be higher. And a lot of a disposable item, which can be environmentally unfriendly, right? What about microwave? Microwave is very new. From my study and from my justification just now, with reference to mobile phone, I think it will be as safe as microneedles. And it doesn't have much environmental wastage. But of course, to accept microwave for use in skin drug delivery is still a long road, because commonly administrators they will feel more worried about the radiation than needles. So needle could be easier to be accepted by the FDA or by the local government.
Hello.
Hello.
I think most of the questions are covered.
Okay.
Yes. If it is not covered, then you have already given your email address, so they can contact you, sir. Please clarify that.
Yeah,
Due to
sure.
lack of time. Okay, sir. Thank you, sir. Thank you once again for your
Thank
nice
you.
presentation. It was
Thank
the
you.
most informative and impressive lecture.
Thank you.
So we all are touched with the topic, sir, today topic. Thank you once again, sir. Thank you.
Thank you.
Hello.
Okay.
Hello.
We happily announce that Vice President of Pharmacy Council of India, Professor Dr. Shailendra Sharaf sir is present among us. Sir, please say few words, your valuable words. Please, sir.
Hello.
Please, Sharaf sir.
Sir. Sir is there.
Yes, sir. Please unmute,
Dr.
sir.
Biplav, I requested you. I was silent, just attend only.
Yes, sir. Please,
Hello.
sir, say something, sir.
Hello.
Just 2 words. Yes, sir.
So before inviting sir, can I,
hello.
sir?
Biplav,
Hello.
can you hear me?
Yes, sir. You are audible,
Yes.
sir.
Hello. Hello.
Gorango, just video off. No?
Can you hear me?
Not audible.
Hello.
Yes, sir. Yes, sir. Continue.
So, all the very best for your webinar.
Thank you, sir, for your blessings. Okay, Vishwal, sir, continue.
Yes, sir.
Hmm.
So coming to Dr. Wang, sir, please, within a few minutes of time, we'll start our second session of today's webinar. Please stay with us, sir, till the end. And next, with all your kind permission, we would like to take a few minutes, 2 minutes time break. After that, we'll be assembled once again, and we'll start our second session of today's webinar.
Just a minute.
Sir, tell me.
Many thanks to the Dr. Wang, and he has delivered a beautiful session. This session is very important for the novel drug delivery system, recent drug delivery system. So I think our pharmaceutical professional will be very much benefited, and I also thanks Dr. Amagundu Basu, he also Hindi and Dr. Ong, they came here, they particularly joined in our session, and in this way, our India will be globalized state country, so that exchange of knowledge and other techniques should come out in such a way that we may challenge any type of calamities like coronavirus, cancer, etc. So we should fight for this jointly. If it is done, then our prospect, our the motive will be successful, and man will be free from all type of diseases, so that survival rate of the man and other animals to be increased. So science is to be practically applied to the betterment of the country. This knowledge will go a long way for catering the quality education, quality medicine, and rational medicine. Thank you.
Thank you.
Thank you, sir. Over to Gauranga, please.
Rahul, hey Rama.
Okay. Move to the next session. Biplab sir. Hello.
Okay, Vishal sir, continue.
Yes, sir. Okay. So before going to our second session, and before going to invite our second session eminent speaker, it's my pleasure to introduce our eminent speaker, Dr. Mrs. Richa Yadayaramani Madam. Madam has completed PhD and MPharm in quality assurance. She has guided around 2 PhD students under her guideship, and also 2 research projects she has completed. She is having PhD guideship in different universities like Gujarat Technological University and Pacific University, Udaipur, Rajasthan. Madam is also having 20 numbers of publications internationally and nationally, including 2 patents. Also, she has published 3 books. She has received many prestigious awards like Best Oral Presentation, Rashtriya Shiksha Gaurav Puraskar, PC Kharia Memorial APTI National Awards in 2019 for Best Principal, Pharma Ratan in 2018, Shiksha Shri Award in 2017, Eminent Pharmacist Award in 2016 and Judges Prize for Best Paper Presentation in 2014. She is also accomplished by co-convener Gandhidham Chamber of Commerce and Industries in Women's Wing. She is also a member of Board of Studies, Gujarat Technological University, Vice President, Gujarat State, APTI for 2016 to 19. She is also EC member, Society of Pharmacognosy, member in MPharm Syllabus Committee, Chairman, serve Independent Ethics Committee, Kutch. She is also a resource person, evaluator, and scientific session chair at various conferences and seminars. She is also having a total of 20 years of experience in different fields, like teaching, with having 15 years of experience, and also in industry, 5 years of experience. She served in Tolani Institute of Pharmacy, which is a government aided, for 2 years as principal, 13 years as a lecturer, and also in industry like Lariago-based company, that is a Ipca lab, that is 4.5 years, and also Russian Pharma, 0.5 years. She is also a life member of various associations like APTI, IPA, Society of Pharmacognosy, Indian Society for Technical Education, and Gujarat Pharmacy Teachers Association, Association of Pharmacy Professionals, Research Scholar Hub, Quality Circle Forum of India, International Science Community Association, and all other society also. Thank you, madam. Thank you once again. I would like to once again invite our today's second eminent speaker, Dr. Dharamani, madam. Please continue, madam. Please carry on.
Thank you very much, sir. At the outset, I would like to, I hope I'm audible.
Yes, audible, madam. Please carry on.
So at the outset, I would like to thank Bharat Technology and the institution, Dr. Rabindra Devnath sir, Dr. Biplab Devnath, and all the organizing members for having me and giving me this opportunity to address a great gathering. And I also wish you best of luck for the future webinars as well. Now, today's my topic is industry academia collaboration. So the world over now there is a craze, and it is the need of the hour also to build strong relationships with the industry and to bridge the gap that is existing between the industry and the academic knowledge interface. So we have, it is a need for everybody, and it is the responsibility of the academicians and the management to translate and transform the knowledge that is available with the academic institutions to the application platform that is available with the industry. So I have prepared a brief presentation which I would like to share with all of you, and the questions will be answered in the chat box. If anybody has any questions, that would be taken later on. Presently, a small introduction I would like to give about my institution where I'm working. So I'm working as a principal at Khyati College of Pharmacy, which is offering a B.Pharm degree course, and it is situated in Ahmedabad. And we are definitely looking forward to associate our institution with the industries that are available in Gujarat. Fortunately, a lot of industries are there in the close vicinity. So definitely we are looking forward to it. Now, what is the purpose of the whole chaos about the industry academic institutions? That we all know that academic organizations are now they are in the phase of transition, or maybe they have come a long way, and now they are much more practical in approach and focused as far as their research is concerned. Just a second. And therefore we need to accomplish collaborative environments to have a free flow of creative thinking. So we all know that pharmacy Earlier it was there was a lot of requirement in the manufacturing sector, but now we want a creative workforce to have an innovation and knowledge transformation into products. So that is why there is a need to accomplish industry academic institutions, and the gap needs to be bridged. Already we had a report of McKinsey that majority of the students that the academia is producing is short of the skills that are required, because industry is changing at a very large pace, and academic research and the academic output needs to be tuned to fulfill the requirements of the changing times that industry demands. Then only our output will be suitable and it would be employable. So it is very, very important in this situation where there is a large unemployment is present in the vicinity. So it is really a requirement of the time, the need of the hour, that we gear up with ourselves and we be proactive and approach the industry to know their requirements, what they require from our students, and what are they will identify the skills that they need, and it is our duty to fulfill their demand. Now next, why the buzz specifically for pharmacy? So as we all know that pharma field is a little different from the other rest of the engineering field or the basic sciences, in a way that pharmacy is a knowledge intensive area, and it is essentially driven by science and technology. So it is not the regular basic science theoretical approach that we need, but it is a more of an application derivative. So and vast domains of knowledge pharmacist needs touches in his or her academic journey. So academia, as we all know, academia will be comprising of the students, the scholars, the teachers, and even the academic management also serves a very important role in this transformation and collaboration with the industry. But so this is all about the academia. What is academia? How do we define it? It is not just the teachers or just the researchers, just the professors. It is the academia means even the students, even the alumni, even the researchers, even the scholars which are working on maybe as an adjunct faculty. Anybody who is affiliated to an institution will be classified under academia. And industry is something which through a process it converts input to output. Now there are basically four types of industries: primary, secondary, tertiary, and quaternary. Primary industry is just involved in the manufacturing. Secondary industry is more about the market, and tertiary industry is all about the service. That means the law or the media or the journalism, the service industry. And the fourth type of industry is a new industry that had come up in the recent times, that is the knowledge based industry. We all know that there is a lot of application with respect to biochemistry, biotechnology, patenting, IPR, knowledge, basically knowledge management is the need of the hour, if I can say so. This is a fourth type of industry. And the pharmaceutical industry model essentially depends on innovation. Here I would like to mention that according to one report I came across, that only 1% of the pharmaceutical market requires 1% is only taken up from the patented innovation products. So largely they are more of the regular selling type of units that are in demand and that are promoted by the market. India being a hub of the market, pharma, you know that every third person is around the globe is consuming the medication that is produced in our country. Our country has a really large advantage, or that the markets are in our hand to a large extent. And if we push new innovations, new drugs into the market, definitely we can push them quite easily as compared to the other countries. So industry realize now how we can have a lock and key model, or how we can what is the requirement of collaboration, and what each counterpart can contribute. So as we all know that industry depends on academia for the basic research, that means to identify the novel molecular targets and for the clinical trials largely, as per the present scenario. So industry wants new targets because they want to push new products into the market and get the benefit for the first mover, and they are definitely dependent on the academia for the clinical trials. And as we all and basically industry has a large large investment that they have done to maintain a good infrastructure, to create and maintain a good infrastructure. But again, they have a short of talented manpower which have a good knowledge domain. And in the academia, on the other hand, we have limited funding, limited research setup, limited infrastructure, but we have the brains. So in this way we can collaborate and satisfy each other's requirements, and we can cater to each other's requirements. So in the past there has been an increase, steep increase in the academic industry collaborations. The data shows that in 2012 we had around 12,500, this is over the globe, 12,500, more than that, academic industry collaborations. And in 2016, just within a span of 4 years, this was double and a half. So, and most of them, like 50%, more than 50% of them were from the life sciences. So this is some good news that is coming for the field of pharmacy. Now, still, if I talk about Indian subcontinent, we know that some of the organizations like NIPER and some organizations of repute have come up successfully with establishing MOUs with the industry for various purposes, largely for the formulation development, for the training purpose, or for the lectures, and that would come under the trainings only. But for the research perspective, for the basic research, there is still a good amount of scope that we can see. So why this is happening, that India is not able to, although India is a manufacturing hub, and we have a good large number of institutions also, we have got a good number of brains also, the academic input is also there, the academic treasure is also there, and the industry partners are also there, but still we are not able to bridge the gap very effectively and efficiently. So why this is happening? So there are certain bottlenecks. We will discuss each one of them, and as far as possible I will try to quote some examples also relevantly. See, what I have seen in my journey, as I have worked in industry also, and now for last 15 years I'm in academics, and I'm working as of now also. I have a couple of industry projects for formulation development, which would be definitely they would be coming in the market. So what I have personally observed is that academia, or the professors, or the academic institutions, they are poor in documentation, in the legal documentation. They are poor negotiators. Okay, they are not, and most of them, they have their own personal interest and a lack of focus. So they have to have committed towards the completion of the industry assignments, and they have to have a fair information to their management regarding the industrial collaboration that they are having. So then only that it will work in a better way. Now industry, industry has money, and it can outsource the research also. It can outsource the novel concepts that are available, maybe from foreign countries. Very easily they can do it, because money is not a problem for the industry. So why they will look upon to academia, why they will look upon to the professors who are present in the nearby institutions? So here I would like to say, I would like to urge or plead to our academic partners, the colleagues, that you have to be pro in canvassing your skills and canvassing your knowledge, and repeatedly you have to approach. And don't think that you need to tie up with a multi-million dollar turnover company like Cadila or Torrent or Ipca or very big companies, because they frankly they don't have any necessity to come to college for the research work that should be translated into market. So Nipur and all, they have done MOUs with the big companies like Dr. Reddy's and all, but Sun Pharma, Dr. Reddy's, Cadila, Zydus. But then it is, I can say that they are only up to the level of an MOU, that is a simple contract. So what about the market? What about the products? What about the revenue generation? What about the revenue distribution? So we are not having any good examples for this as far as Indian scenario is concerned. So this is the first point. The first bottleneck that I have cited is that there is a fundamental lack of understanding about each other's motivation and work pressure. What is the motivation of a teacher, a professor? That I do some research and I want to get it published in a elsewhere or Scopus listed journal. That is the biggest motivation. The second motivation is the personal, maybe monetary gain. And the third motivation may be a sense of recognition that the academician or the professor requires, right? So these are the three important motivations that that an academician is looking for. Whereas industry, they are focused. They are not person centric. They are focused and they have very tight schedules. They have tight timelines, and they need they perform under tremendous work pressure. So they are bound by time, and they don't have this repeated testing, repeated repeated investigations. They will not wait for that. So one has to be very, very focused and very, very accommodative and ready to work 24 hours because academic load will also be there. But then here the role of management will come, that management has to understand that there is a documented MOU, and accordingly their academic load should be minimized. Okay, so there is a fundamental basic lack of understanding about the both the parties, about each other's motivations and work pressures. So, and then as I already told that we lack in documentation part, so that our document does not we have to first look at our culture. What is our culture? Whether our culture is just passing the students and putting them into industries. What are the goals? What are the guiding principles? How ethical we are, how professional we are, and what is our working ecosystem. And if we are ready to collaborate with industry, it means this is something serious business. We can't be just for the paperwork or to show some certificate that we are into a collaboration with so and so industry. It is not going to work. It will serve your purpose being an academician, but then the industry partner will not be interested at all, and he may just lend you one piece of paper for 1 year or so, and then they will not see you. So we have to understand there is a cultural difference, there is a difference in the goals and guiding principles. As I already told you that for academia, publication is the major goal, whereas for the industry counterpart, it is the launch for the human trials, phase 3 and phase 4 trials are more important. And with that also, it is under strict, tremendous pressures. We can very well understand the pressure. See, most of the companies, biotech companies, are now focusing on developing the COVID-19 vaccine. Okay, so can you understand what a biotechnologist or what a researcher in the industry must be going through? They must be working tirelessly day and night to, be the first first company to launch the vaccine into the market. And so academia also must be ready to participate with industry with the same pressure. If they are able to jelloing the same pressure, then only they will be able to survive. Industry will not work in a leisurely manner or casual manner. They will never do it, because each and every minute is money. Now academic as I already told you, that academic partners, they look for them the prestige and the technological expertise is much of more importance than they boast upon that. but they are somewhere they are not very targeted or focused on the requirements of their counterpart. Then here I would also like to mention that from industry also we need to make them understand, we as an now I'm talking about as an academician, so we should make the company or the industry counterpart understand that the investigations, course of investigation has changed. It was not earlier it was very simple, but now it is complicated. Each and every aspect needs to be tested, needs to be established, and needs to be documented. So it takes time, and what is the plus and minus of that, we should be able to make them understand in a amicable manner. And then definitely we cite that there is a lack of open communication between the industry and the academic counterparts. So there should be one single point contact from the industry side and single point contact from the academic side as well, because too many people involvement, they will spoil the broth, and there will be a lot of communication gaps, and then the timelines would not be met. Academicians have widespread indifference towards applied research, because academicians are in a state of comfort zone. As far as they are concerned, they are in a state of comfort zone, that what is our basic duty is that we have to take lectures and we have to prepare the mark sheets, we have to take examinations, and that's all for us. That is our basic core responsibility. Whereas we are not very much pro on the towards the applied research, and we are not that much, because definitely our monetary gains or the pay or the salary which we look upon will be for the lectures only, and we won't be so that promise should be there from the management, and that effort should be there from the management to compensate or to remunerate the academician accordingly, according to the work or the partnership that partnership that the industry is citing for. So the academician needs to be heavily also appropriately paid for the work that they are doing. There are so many practices that are going on in the academic world, and that needs to be sincerely taken care of, so that we get the best output from the academicians as far as industry academic collaborations is concerned. And those who are in the management know what I'm targeting on, what I'm saying about. Now, one very important aspect, which is a bottleneck for an effective industry academic collaboration, is that the liability. Now each and every as I already mentioned, that documentation is poor, but suppose if we want if we come up with a very good documented documentation of our industry academic collaboration and the goals and objectives and a focus for the particular product or for particular assignment, then we need to clearly mention that what will be the liabilities for the academic partner as well as for the industry partner. So who will be legally responsible for what, and under what circumstances either partner could be sued. So when there are such important and fearful clauses, then only that output will come from the academicians, and they would be serious about their work. As I already mentioned, that industry timelines are the most important thing, and they are not worried about the people, they are not worried about the money that they spend, but they would spend any amount of money provided the timelines are met and the results are promised, the results are delivered. So with every perk there is a liability, as we all know. So we should be ready to take a calculated risk as academia entering into an effective industry academic collaboration, and then only we should take a call. Just jumping for a industry academic collaboration and just showing on the paper that, hey, I have got 10 MOUs, I have got 5 MOUs, but for what? For the lectures or for the training programs, it doesn't make more sense, unless and until your knowledge is translated to the product through some industry partner. So that is what actually we are looking for. Okay, now there are some other bottlenecks also. that academicians are reluctant to leave the comfort zone. We know that we are very much comfortable in taking the lectures and this one only, and pure teaching we all enjoy as academicians. So we are not ready to come out of this comfort zone and work, not a little extra but a little more, to satisfy the requirement, and to really be able to say that yes, I have a good industry academic relationship or industry academic collaborations. Universities are generally inflexible when dealing with collaborative projects, and typically present additional levels of restrictive internal policies and procedures that hinder innovation. So innovation is directly proportional to the creativity, and creativity is directly proportional to the fertility of mind. A person, when he is in a state of free thinking process, can only deliver innovation. Then only some creative thinking will happen. Creative thinking will never happen under pressure. It will not be very effective, and it will not be of long duration or in a promising manner. So in universities have to appreciate that the brain power working with them as professors, as senior professors, they want some different type of feel to be productive at a level of innovation. So innovation can only happen when a mind is free to think, and the mind is fearless to say. So private universities or even government universities and the top management, they need to understand, and they have to be flexible when they are dealing with collaborative projects. They should not treat the professor or treat the person with restrictions, lot of restrictions, and they should be eased out to be able to deliver. But then I would also insist that the paperwork should be that strong. You need to have a good paperwork. Yeah. Then academia is generally unaware of the real industrial and national needs. Yeah, this is also one drawback and one important bottleneck for effective industry academic collaboration, that most of the academic professors or academic manpower that we are having, they have never visited industry. If I talk about pan India level, only some percentage, very handful percentage of academic institutions and the people working there have actually really visited the industry or worked with the industries at a level of where they are able to understand the whole process and the whole system of industry working. And just working as an MR or just working as a some officer or chemist, that is not real working. You need to have a good idea and a fair idea regarding the policies and the needs and the pressures and the industrial scenario and how it really works. So they should have some basic idea about the working of industry, and then only academia would be able to sensitize itself and sensitive enough sensitivity to deliver, because they can take a 1 year 3 year project, and then they can just simply they will change the college, and they will not bother to address to the industrial requirements. So why industry will waste 1 year or 3 years and with the institution? So industry is reluctant to collaborate with academia for good projects, for money making projects. They are really reluctant, because then there is a mutual trust is not present. Because professors, there have been some bitter experiences of the industries with the professors earlier, and those serve as the basis of future collaborations. So there have been some bitter experiences, and the promised was not delivered, and many times it has happened. And that is why industry is reluctant to collaborate with academia for important projects. For the small projects they can, but for the important projects they are reluctant. Then there is a lack of appropriate incentive to faculty, as we already discussed previously, that faculty should be paid well, and extra incentive should be offered to the faculty who is working with the industry, and they should be relaxed, they should be facilitated, but in the purview or in the restrictions of a proper documentation and legal obligations, and then only we will get the best results. So also because of the internal policies and the internal scenario or the institutional politics, the working faculty most of the time is targeted, and so this is also one bureaucratic problems are there, and recognition is not there. So most of the faculty are under a state of identity crisis, and there are also bureaucratic hiccups in utilization of consultancy funds. So these are all the real time scenarios that I have personally experienced and felt, and I feel that one should, if an organization, if a university, or if an institution wants to come up with good industry collaboration, effective industry collaboration, where the academic where the institution can claim that yes, this product is there is a percentage, or there is a good role for this product which is available in the market, then that is an achievement, and that achievement will come only when there is a proper deliver of elimination of such bottlenecks. Then a very important bottleneck for effective industry academic collaboration is the irreproducibility of the data that is coming from academia. We all know what is the status of research and how research is actually taking place in academia, and most of the research, the data that they are submitted is not reproducible in the industrial setup. So scaling up of the data, the lab, I'm not saying that the data is false, but the data which is coming from the laboratory may not be producible at the same level in when the whole research is technology transferred to the industry. So now everybody is well aware of, and industry is not ready to collaborate for such delays and such gaps. They are not ready to accept that. So how to bridge the industry academia gap? So just we have talked about the bottlenecks that are present, means they are the hiccups or they are the problems that are present, but how to address these problems and how to bridge the gap? So there should be a free and open exchange of information. That is very important. Transparency is very important. Trust is very important, and there should be a free and open exchange of information from both the parties, from the academia as well as industry should be there. And there should be a mutual trust and exchange of ideas. There should be frequent meetings between the important people or the team or the industry representatives and the academic representatives. There should be frequent reviews, there should be frequent discussions that should be held in order to materialize that project. And there should be a creation of a chair, most probably from the academic, one from academic, and co-chair can be from industry, who will steer the whole project. And there should be a provision of incentives as we already discussed, and the appropriate infrastructure and facilities should be made available from out of the consultancy fees. Proper allocation of consultancy fees or consultancy revenue should be there. And the diffusion of knowledge through interaction with the peers. Now peer discussions are very uncommon as far as academia is concerned, and even from the industry counterparts, the peers from the industry, the discussions are not very frequent, the discussions are not very transparent, discussions are not very open. So we need to have such type of discussions. We can one important treasure that academia is having is the alumni potential. So here our successful alumni can act as mentors for the students, and the students of final year or maybe third year can be groomed according to their abilities and their interest, and they can be trained as apprentice. Because now earlier what used to happen, that a person would graduate, then they will work as an apprentice, and they will get their training in that period of maybe 1 year or 1.5 years, and then they would be absorbed for the real jobs, the real shop floor. And over the years this apprenticeship thing was deleted, because industry it was time consuming, and industry was not ready to invest into this type of training purpose. And then on the job training concept came. that graduates would be trained on the job, and on job training was popular. And still now the industry felt that the job under job trainee, they would get trained and they would leave them. Okay, so again industry is no for this on the job training. And now they are asking the academia, because they the academia, that we want the student who is academically sound as well as skillful and trained according to our requirements, and you supply such type of students to us, because pharmacy being a professional and technical course, it is a practice based course. So we can very well cater to the demands of industry. We don't have to aim for very big industry, but the MSME sector can be a good client for the institutions. We have to search, I already mentioned the 4 types of industry that are present. So it is not that we have to search for the manufacturing sector only. We can have a service sector as our client. We can have the knowledge management companies for as our clients as well. So we have to pull the top notch talent to the faculty pool. The faculty pool means the teachers that we are having, they have to be really talented, and the institution should be in a position to retain such faculty. And they can have this by methods of adjunct professorship, or industry professorship, or corporate professor maybe. So some people can be engaged from the which have the clear understanding of the working of industry, and they are ready to share and disperse their knowledge with the young students. Involvement of undergraduate students with the industry makes a proper hit. Yeah, so our Pharmacy Council of India has already sensitized with this aspect, and they have already introduced the concept of practice school in our curriculum, and the whole final year is largely catering to this requirement. And here I would like to also say that it should depend on the ability and interest of the student, and not should be forced. If it is forced, then it will not serve the purpose. So I would like to ask the institutions to have a good idea, comprehensive idea regarding the abilities and the interest of the students, and based off that we can select the industry partners. So there are few other areas where we can bridge this gap, is that we can have interface structure. That means we should have a structured documentation, a structured methodology, that how our institution will collaborate with the industry, and this would be the nodal point contact. These are the set of documents that one should sign. These are the set of activities that one should perform. This is the job profile from the industry side and from the academic side, and the such type of structured interface will definitely cater to the demand, or solve the purpose of the whole industry academia collaboration. And we can also have a consortium between the academia, the industry, and the R&D lab. So industry here may be the manufacturing industry, or the service industry, or the knowledge industry, and research and development category, which is specifically addressing the requirements of the academic and industry portfolio, can be taken into loop, and focused or very targeted projects can be designed. Small projects can be designed which are innovative, which are creative, and which are very very focused, and having which would be completed within a short time limits, so that we can utilize our faculty in an effective manner. Very long projects, eventually the people lose their interest, the academia lose interest, and industry scenario totally changes, because it is very very dynamic. And this can be done through incubation centers. Already our government is funding so much for for setting up the incubation centers, and entrepreneurship development is the buzzword now. So we can take advantage of the such schemes also, and we can connect with the nearby institutions who are having some cutting edge with respect to a particular professorship. And here again, the management or the university has to be should be ready to collaborate with the nearby institutions also. There can be an institution collaboration for serving particular requirements. So, but everything needs to be really well documented, and then only some effective output would be there. And enhancement of technology transfer towards commercialization. So we transfer the technology, we conduct some research work, we complete it, and then we transfer that technology to the laboratory. But we then
আমি যে শুয়েছিলাম আমারটাও এরকম রেকর্ডিং হয়েছিল মনে হয় নাকি কি জানি
hello. Yeah. So but then what about the commercialization aspect? So whether the academia is notified, whether the academia is um, is addressed with the due credit for commercialization, because we are also not taking any review for that. So we have to ensure that our we are accredited, our due due appreciation is also shared after commercialization to the academic or knowledge partner. So setting up of venture funds, especially the management, the universities should allocate some funding for such innovative entrepreneurship or academic entrepreneurship. So this type of management perspective will really fuel the academic innovation, the academic translation of knowledge to product and to market. Now alumni, as we have already discussed that this part I'm not going to repeat, because we have already discussed how alumni potential can be tapped, and how alumni working in various industries can act as mentors, and they can give guidance, they can provide the guidance, and they can train our students or aspirants for the job, and what are the do's and don'ts, and what are the opportunities, what are the current business trends. This all I think most of the academic institutions are doing, so that needs not to be mentioned over here again and again. And yes, government should also take initiative to open various entrepreneurship cells in academia, and government is allocating some funds, but I don't think so we are receiving it in a timely basis. Most of the time we see that we get the funding approval letter, but then the realization of funds is very late. And by that time, because we are not able to if suppose the management is not ready to invest proactively for that, because they are not sure whether the government will actually transfer the money or not. So these are the some bottlenecks, because every institution does not have the risk taking capacity, and the investments are not available that much. And now because of this COVID situation and all, academia is really under pressure, management are really under pressure, and there's a shortage of funds. We all know liquidity is not available as of now. But yes, pharma, as far as pharma is concerned, or life sciences innovations and creativity is concerned, we surely see a good bright future in our area of work, luckily. But still we have to be smart enough to collaborate with the industries to translate our knowledge to market the products. Intensive programs under visiting professorship schemes. So the retired or the senior people from the industry who are having a vast knowledge and vast experience, vast skills, they can be very, very resourceful for an academic institution, and they, if they are ready, they can set up our labs, they can guide us that this is something very theoretical and this is the actual thing that is happening, this is the latest. As I would appreciate Dr. Wong's lecture, he spoke about while answering to a question, he spoke about reinventing the microwave equipment. So this is something very real, and such type of thought process, one day it would be translated into the desired equipment. So we need to look not only to the pharma institutions, we should be ready to collaborate with the engineering and the computer IT institutions as well, because nowadays we are living in a world of IT, and fourth industrial revolution have already pushed us in that domain, where we produce innovative IT based solutions for healthcare. which are very fast, which are very simple to use, which are non-invasive, and which are able to take care of the general routine day-to-day problems that humanity is facing. So every time it cannot be very chemically complex and invasive, or needling and puncturing lot of medications. No, it can be very simple. It can be the identifying parameters, like blood pressure, temperature, the change in temperature. In India, I don't think so before COVID we ever could imagine that there is a gun like device through which temperature, IR based temperature monitoring device was not available in India. At now it is a common scene. And what is this? This is a simple gadget must have come out with the help of one pharma person and one IT person or one engineer. So such type of collaborations, interdisciplinary and multidisciplinary collaborations, can also translate and cater the innovative requirements that industry wants as of now. So commercial viability of the research, all the time we should not like if we focus on complex research, then the output that we are getting may not always be marketable, may not always be commercially viable a project for the industry, and industry may not be interested to commercialize that concept. So just after the concept is the research is done, because the investments, the commercial viability, the acceptance in the market feasibility, these all are the current factors that exist in the market. And because of this also, industry is reluctant to collaborate with academia, and they find most of the academic research is non marketable. So what academia needs to do is that, it is not, I'm not saying that you stop such type of research, the complex research, we can do it, but we should always allocate some percentage of the faculty for the simple research, and who are ready to take up industry defined projects. So such type of small modules can be devised. I had been fortunate to be selected in the UKRI leadership development program, and over from there we were interacting with faculty from Dudley College, UK. Now they told us that because of with their experience, they have collaborate with the industry present in the near vicinity, and of late they have come up with a completely one arm or vertical which is dedicated to the industry. So now the academia is working 100% for the industry, right? So this is good. In academic knowledge or the brain power is utilized for commercialization, and there we have a ready customer for it. So we want such type of collaborations in India also. So the management should be very pro, and good interface, good exchange and transparent exchange of knowledge and services should be there. Focus should be there on reproducibility, as we already discussed that just offering the lip service and producing heaps of data before the before the industry is not going to work. So don't just say this is what we did. We have to tell them how we did it, and the lab output should be in line with the industrial output. So it should be, we should be able to translate the same academic output to the industry output. So we should not here I would also say that a publication is the dream of every academicians as of now, but then so much detailing and so much of just theory work and producing plethora of literature and data is not going to help. If you want to be innovative, if you want to be an academic entrepreneur, if you want to do something different, and you are really interested to bridge this gap between academia and industry, and starting early, it is not necessary the management or the principal is saying that only on a professor level then only you can collaborate with the industry. We should be open for to accept the abilities of the young talent. And so instead of, if we have some good project, if we have some good idea, then at that stage only we should look for industry partner. Not that we are developing some molecule and then we are approaching the industry for the preclinical research. So right from the concept, if that industry academic interface is very well defined and well functioning, then right from the design stage only that product is visualized and it would be designed. The whole route and the roadmap is very clear after that. So everybody will work in harmony and everybody will have a common objective of achieving what is desired outcome from a research project. So we have to start early rather than doing the academic work, the research first, and then approaching the industry partner. Just at the conceptual stage only we can have collaborations and we can approach the industry. So then find the middle ground in order to settle the differences. It is very easy that okay, you go and you search some other academic partner, and industry can also say that we can search some other partner. No, but we have to find some middle ground to settle the differences. There will always be differences when there is a research project, where when there is a series of discussions, when there are so many minds involved, there would be differences, but then we have to find some middle ground, and arbitrarily we have to settle down the differences. And as I already told, that there should be frequent round of meetings to settle. So we have to talk it out, we have to discuss very openly and very transparently what are the hiccups, what are the hitches that academic is facing during the accomplishing the research projects, or what are the developments within a research project. And that all that discussions should be very transparent, and they should be frequent also, so that industry is also aware that these are the problems that academia is facing. So trust, level of trust and mutual respect is very, very important when we want some really fruitful benefits if we are looking for. And the aim should not be solely monetary. We have to work with lot of zeal and interest to translate our ideas into the products, and for the delivery, for the identifying novel therapeutic targets and transforming the academic discoveries to industry. So I could get hold of some quote that the secret in care of patient is actually caring for the patient. Just not saying that we care, but we actually care for the patient. Then only true partnership would materialize. Because industry, they are very much, they want to produce market acceptable products, but then academia has to really get involved in each and every aspect. And we all know that we are working in an era of competition and globalization, where the world is getting smaller and smaller, and there has to have a great enhance to impact the research project. So we have to work beyond our capacities, we have to explore new skills, we have to unlearn what we have learned till now, and we should be able to absorb new developments, and what are the pros and cons of our future knowledge. So this all needs to be managed in a very careful manner. We have to be well curated about our own self and our own deliveries, and then only we will be able to survive. So these are some case studies. They are from foreign countries only. I could get some successful case studies that Novartis International has collaborated with Harvard University. They have had some breakthrough launch in the market, and very successful products, and which Harvard Medical School has worked with for Novartis. So this is a real real academic institution academic industry interface that we are looking forward. We are talking about it in India. Then other one is BG China and University of Copenhagen. UCH as it is popularly, UCPH as it is popularly known. We can have a lot of videos also available on YouTube. How they are, discussing and how they are presenting their videos is also very amazing. So there is a collaborative relationship. BGI is a very well-known big pharma company based in China, and they collaborated with University of Copenhagen, and even AstraZeneca has collaborated with University of Cambridge, and this is AstraZeneca is a well-known pharma company, and now most of the companies are working in the field of biogenetics, and to address the rare diseases and geriatric diseases, neurodegenerative diseases like Alzheimer's, Parkinson's, sclerosis, and these are all the biopharmaceutical giants that have collaborated successfully with universities like University of Copenhagen and University of Cambridge, and they are working very closely and successfully. Another case study, another example is like Spinzara, that is a marketed drug launched in 2016, and it was an outcome of the collaboration between Cold Spring Harbor Laboratory and Ionis Pharmaceuticals. So this is also a collaborative output, and University of Massachusetts Medical School, America, and Dr. Rabindra Singh from ISIS Pharmaceutical were instrumental in translating the research to the product that is known as Spinzara. That is a breakthrough drug for spinal muscular atrophy, and this drug was US FDA approved this drug in December 2016. Another drug that is sold under the name of Kymria, that is an innovator molecule again, and this was the result also of a collaboration only between University of Pennsylvania and Novartis. So over there you can see that foreign companies are giving due credit to the academic partners, and academic partners are also delivering the best, and they are also delivering what is promised to the industry partner. They are working very closely hand in hand, and they respect each other's pluses. They respect each other's positions. Yes, Dr. Shantanu Malik, you want to ask something?
Yeah,
Please
no, ma'am, please
unmute
continue.
yourself. Okay.
I will ask.
Yeah, no problem. So this is all. These are the case studies. These are the examples, and whatever I knew, I could summarize in a small time of 50 minutes. I tried to present. So now I invite the questions if anybody wants to ask.
If any questions are there.
Yes.
Mr. Nilayan, sir, you can ask, you can forward those questions to madam. Madam can, so that madam can answer, clarify those questions. Madam, can you see the questions?
I can see the chat.
In chat box, it will be there, sir, madam.
Okay, there is one question. How to make it mandatory for an institution so that industry academia interface can be implemented through change in syllabus or through some live project or through some incentive to faculty for search work? Yeah, this is a very good question that is raised by Dr. Amalendu Basu. See, first of all, the institution as a whole needs to set up an industry academia interface. So our industry partners should be well identified, and they should not be a broad perspective to this collaboration. They can be collaborating for particular purpose, specific purposes, some specific short-term research projects, and it is not necessary that every institution should mandatorily indulge into academic interface, industry academic interface. What if there is no industry existing in the vicinity? So how do you think is it possible for the academic institution, if they don't have the funds, if they don't have the able professors or able researchers to cater the requirements of the industry, to talk to the industry, to visit the industry multiple times. You need to visit the industry. So I don't think so that it should be made mandatory. It holds importance, but then one academic institution may be very good at academic dispersion of knowledge. Other academic institution can be very good at placements. Third, another academic institution can be very good in the industry academia interface. So we cannot measure each and every academic institution using the same set of ruler. We know that elephant is big, and the birds can fly and fishes can swim. So every academic institution also has certain plus and minus. So any institution cannot be made mandatory to indulge into academic industry interface. When you are not able to deliver anything, then there is no purpose solved. It will just be on paper, right? So this is one thing. And change in syllabus, that is what I'm saying. Why we want to unnecessarily complicate that each and everything should be syllabus oriented? What is the requirement? There is India is such a vast country, and there are so many aspects that are that our Indian academic institutions are addressing or catering to. There are different levels of the society. There is a different mix of the society that is available as students to us. So so I don't think so that each and everything should be oriented through the syllabus. We all know that there is a common syllabus or a guideline syllabus that is available by our regulator, Pharmacy Council, but then university or the autonomous institution also have power to make it flexible, to vary it up to a certain percentage. So we can take advantage. We can always deliver something extra. So that will purely depend on the capability and the ability of the institution, the knowledge of the professors, the ability of the professors, the willpower, the willingness of the academia to indulge into such projects. So this is my opinion. There is another message I would just, yeah. Okay. Apart from, there is another question that is put by Dr. Santosh Ganguly. Apart from the R&D sector and a few handful of manufacturers, most of the industry focus on sales. Okay. Yes, sales are important. If there is no, how any industry will produce with no sales? So, however, having an understanding of manufacturing, quality control, assurance aspects are also very important for our students. So my question is, how can we collaborate with such manufacturers? Yeah. Okay. Now there are two types of industries. One is the manufacturing industry. Other is the research-based industries. Means we all know that in pharma there are largely there are two groups of manufacturing industry. One is the actual manufacturing industry, which is selling their own products, which are marketed by the by that industry and manufactured also. Like for example, Cadila. So Cadila has IPCA has Lariaco, which is R&Dized by IPCA, which is manufactured by IPCA and sold under the label of IPCA. Then there are certain other industries which are into third-party manufacturing. So you just give them a formula and they will manufacture it for you and you have to market it. So there are two types of industries that largely exist in India. So those industries which are having a manufacturing base, that means they market their own products under their own brand names. So such industries are important for us to collaborate. Why? Because these are the industries, these are the candidates for our collaboration who would be really interested to develop new products so that they have a niche in the market. They have the first mover advantage in the market. They would be really interested. So what we need to do is we have to approach them and we have to tell them that we have to make them aware that we are having such and such talented professors, talented researchers. We have got such and such facilities, and if possible, we can do some homework with their product and we should proactively tell them that this is some loophole or lacuna that is existing in your product, and this is the way we propose we can innovate it and we can propose a solution to this problem. So definitely such type of work will attract the manufacturing company, and they would be interested in the academic partnership. There would be fairly, I think that they will be impressed by the work that. So but academia has to proactive, we have to approach to the industry, because industry is under no obligation, they are making money. So with their existing products also they are able to make money. So prima facie, as of now, we are at the demanding end abhi ke liye, for the current situation. If we are able to establish ourselves as good researchers and we have a strong industry base, then we can expect some companies to come to us. But as of now, it is our turn to approach the industries from our end. So I hope I have answered this question satisfactorily. Dr. Somendu Deb Roy, this collaboration is need based one. Yes, very good. This is the answer that I agree to. Then there is another comment. The Drug Controller General of India has approved emergency use of remdesivir injection formulation for treatment of suspected and severe lab confirmed COVID-19 cases. Yes, you are right. The MRP of remdesivir marketed by Hetero is 5,400. Recently, Hetero has launched remdesivir, but consumers have reported it being sold between 15,000 to 60,000 at many places. Okay, DCGI takes to curb black marketing. So, madam, my question is, what is your suggestion and how it will be minimized? Now, okay, this is something, this is, if I may ask, since your question is that open, may I have the liberty to ask, when there are very good admissions in your institution, don't you charge a premium fee for the for giving a seat or giving a seat to the students? Don't you charge? So this is a common human tendency, and India is a developing market. India is having a lot of numbers. India is having many disparities, and people are ready to pay. There is a capping, but I'm not aware whether this 15,000, this is purely, related to the ethics. Then the MRP of Hetero may be 5,400, but then the availability is an issue. And the marketing companies have to work extra to get that remdesivir from at a rate, and then to mobilize it to the customer, to the patients. So maybe they must be charging for that additional work. So right now I'm not I don't think so I am a suitable person to give a suggestion how it can be minimized, because it really addresses, and it is a question of personal and professional ethics that is that exists, and I'm not a suitable person because I'm not a regulator, and neither I am into the drug market sales. But yes, I definitely know that this is a human tendency, that is the market behavior of demand and supply, that everybody understands. I hope I have answered reasonably your question. I'm not able to hear any voices. I don't know.
Hello.
Any more questions?
Thank you, madam. We have planned earlier to organize this workshop at our institute itself, and you have been also invited. Due to corona effect, we have been isolated. So virtually we are not isolated. Knowledge is such a way that it is scattered from one to one through the it will be faster than the corona speed. So then only we will overcome the present situation, and any type of challenges we can overcome. So
yes, I am really thankful to you, sir, Debnath sir, and Dr. Biplab Debnath also, for inviting me and giving me this opportunity to interact. And I hope I have lived up to your expectations.
Yes.
Thank you.
Yes,
very much.
Thank you, madam, for your nice presentation also. Really, it was a very interesting and also nice topic, because looking to current scenario in pharmacy profession, it is required that industry academic collaboration, it is very much needed. So for the pharmacy profession development also. So this is what you have clearly covered all the points. And one point I would like to tell you have covered very clearly that what are the parameters, significance, factors which are required, like your documentation part also, madam. Thank you, madam. Thank you once again. Then coming to next, I would like to invite my fellow colleague, Dr. Soma Jana, madam, to give a vote of thanks.
Hello.
Madam, start.
Hello.
Carry on. Madam, carry on.
Is it audible, sir?
Audible, sir. Audible, madam.
Okay. Okay. Good evening, one and all. To the venerated dignitaries, honorable delegates, directors, sir, chairman, sir, convener, sir, guests, and my dear students. Every special moment come to an end, and today's this webinar program is also not an exception. So now this is the time to speak about vote of thanks. It's my privilege to have been asked to propose vote of thanks on this program. Myself, Soma Jana, Assistant Professor, Department of Pharmaceutical Chemistry, on behalf of the organizing committee of Bharat Technology, extend a very hearty vote of thanks to all who have helped us in making this webinar program such a resounding success. First of all, I would like to express my sincere gratitude to our eminent distinguished today's speaker, Dr. Wang sir and Dr. Saraf sir, and also Dr. Richa Dairamuni ma'am for their enlightening and motivational address, for making excellent presentation and sharing their views with us regarding topic of innovative strategies and oral pulmonary and skin drug delivery for cancer and diabetes treatment and industry academia interface such contemporary relevance. I am deeply grateful to our respected director, Dr. Robindranath Debnath sir, for his moral support and energetic guidance. I take this opportunity to express my thanks to the chairman, Dr. Kuntal Hajra sir, and convener, Dr. Biplav Debnath sir, for their constant inspiring and encouragement. My special thanks also go to all the delegates and participants. Without your support, presence, and encouragement, we would have not been achieved so much within so short time. I also would like to acknowledge my gratitude to the all faculties, teaching and non-teaching staff who are directly or indirectly involved in this webinar program. My thanks are also due to the students who have worked with great dedication to make this program a grand success. Looking forward to meet you all people in upcoming new webinar program with new topics in new areas of research in pharmacy. Let us fight all together against present pandemic COVID-19. Stay safe, stay home, and stay motivated. Thank you all. Good night.
Thank you, madam. Thank you once again. Now, we came to an end of the today's session, madam. So before winding up today's session, I would like to request to both of the speakers in today's webinar, eminent speakers, on behalf of management, staffs, students of our institution, I would like to request to both of you, at any time if we need any support and help from your side, please extend your helping hands to us always, so that we will be obliged and grateful to you both.
Sure.
With this, I conclude today's.
Thank you. It will be our pleasure. Already Dr. Debnath is such a wonderful host. I have visited Kolkata twice already, and I look forward for many more such offerings, and whatever I can offer with the best of my knowledge and abilities, I would be really with pleasure. I would do that.
Thank you, madam. We will be all time blessed. Thank you, madam.
Welcome.
Yeah,
Over to Biplab sir.
yeah, I mean the
That's
same
okay.
for me also.
Yes, sir. Wang
So,
sir.
Yes, sir.
look forward to meeting each other perhaps after COVID.
Okay, sure, sir. We'll meet you
Okay.
after